Hello and welcome to the latest Q&A with Asthma UK and the British Lung Foundation's in-house GP, Dr. Andy. In this episode, he'll be talking to our campaign manager, Joe Aldrich, about guidance for wearing face masks now that lockdown restrictions are starting to ease. And he'll also be providing some useful tips for using your inhaler too, so we hope you'll stick around. If you need any information about anything discussed today, you'll find lots of useful links in the description below. And don't forget, if you find this video helpful, please do let us know by giving us a like, leaving your comments, or subscribing to our channel today. And if you feel able to and you find our health advice useful, please do consider making a small donation today to help us continue defending the nation's lungs.
Hi Joe, how are you keeping?
Very well, thank you. How about yourself?
Yeah, not too bad at all, thanks.
Glad to hear it. Glad to hear it. Andy, so once again, it's Q&A time. So I've got a list of questions for you, many of which are frequently asked via our helpline and also frequently related to frequently visited web pages on both the Asthma UK and the British Lung Foundation website. So hoping you'll be able to help us out once again. There's been a lot in the news recently about face coverings and how rules around wearing them is changing. So just wondering what you think about this and what you think people should do in terms of wearing face masks or not.
Well, over the last year, I think, year and a half it's been, hasn't it? So we've learnt about hands, face, space. So that's where we've sort of been washing our hands and following hygiene methods by using face masks and then social distancing as well. But also doing self-isolating and getting tested if we get symptoms. And on top of that, then the vaccination campaign. And together, all these things that have helped to reduce the spread of COVID-19, to stop people getting ill with it, and has really made a big difference. Not one of those things is 100%, even the vaccine. So it's important that we do as much as we can to try and keep ourselves and the people around us well as well. So a lot of people, including me, actually are quite anxious about the lifting of restrictions from the next sort of week or so. The first reason is I think we need to be trusting other people more, and we don't always know whether we can do that because we've been isolating so much this last year. And the government shifted responsibility to us as individuals, but also to employers to keep their staff safe, to owners of bars and restaurants and shops, to develop their own rules of what we can do and can't do when we're out and about. And as we're recording this, I know that Transport for London have just said, and some shops are also saying that they will make their rules that people need to be wearing masks either on the transport or in their buildings. It sounds like Wales are looking at making or keeping masks compulsory in public places and on public transport, and Scotland as well. It sounds like shops and public places, including restaurants and pubs, if people aren't sitting down, will also need to keep face masks as well. But this is a rapidly changing thing, so keep an eye on not just on our website, but on what your government is saying and what your local regulations are. But what we can do is do what we do ourselves, so look after ourselves and the people around us. So if you can wear a face mask, I'm going to advise you that you should still keep using it, especially if you're in enclosed spaces or indoors or where there's crowds or a lot of people close together, with people you wouldn't normally mix with because they'll be carrying different germs to you and they might well have COVID as well. And also I'll be wearing a mask around people who I think are at greater risk. So I will still be wearing a mask at work, you'll be glad to hear. But actually, if I'm out and about with relatives or friends who are perhaps more at risk from COVID, then I'll be wearing a mask around them as well. So there's lots of things that have been taken out of our hands a little bit, and we've lost a little bit of control because of the government relaxing restrictions. But those restrictions are still going to be in place in some places, and there are still things that we can do.
That's great, thank you, Andy. So the next question relates to the booster vaccines. So the JCVI, which I've been reliably informed stands for the Joint Committee on Vaccinations and Immunisations, is currently advising that booster vaccines should be offered from September to people who are most vulnerable to COVID-19. Could you give us a rundown of what this advice is and whether it's likely to change before September?
You're absolutely right. The JCVI are a group of scientists and experts who advise the government on what should happen around immunisations. And that's not just COVID, that's flu, pneumococcal, things like that as well. And until now, they've recommended all adults get vaccinated against COVID-19. And they're advising that based on all the evidence that vaccines are safe, they're very effective, they've been shown to save lives, reduce severe illness, and stop the spread of COVID-19 as well. No vaccine is 100%, so it's really important that as many people as possible get vaccinated. So if you haven't had both your vaccines yet, there's still opportunity. Contact either the government website or your GP surgery to find out where you can get your vaccines now. But on the back of this, from September, they're recommending a booster campaign to help boost the people who've already had the vaccine, to boost their immunity and to help them fight off COVID, especially with the winter when that's when viruses spread the most. So as well as COVID-19, from September, this group will also be offered the flu jab as well. And the first priority group will be people over 70, adults who have got they're immunosuppressed, whether because of a disease or because of the medicines they take. So all adults who are in the clinically extremely vulnerable group, so that was the shielding group, they'll be invited in for this in the first group. But also so will people who are resident in a care home or a nursing home. And of course, everybody who's working in frontline health and social care will also be offered it. As soon as that's done, they will also then be extending that to give booster jabs to the over 50s and to those who are aged between 16 and 49 in the at-risk groups, who are and people who are household contacts of people in the most at-risk groups as well. So I think we're still sort of waiting for final guidance. This is what the JCVI are recommending at the moment. But I know there's still some research being done and they're looking at what the best way of doing this is, who are the best people to be giving it to first, and also, more importantly, how it's going to be delivered by the NHS or by the vaccination service. So watch this space. Please keep an eye on our website. There will no doubt be plenty of this in the news. So keep your eyes open and there will be more to come on this soon.
That's really helpful, Andy. Thank you for that. And just to say to everybody watching at home that all the advice that we're providing is correct at the time of filming, and we'll include any helpful links in the description below as well for the latest guidance from both Asthma UK and the British Lung Foundation. And please, if you do find this video useful, give us a comment, a like, or subscribe to the channel to be the first to hear about upcoming videos from Dr. Andy and Asthma UK and the British Lung Foundation. Andy, the next question relates to inhaler techniques. So we know that people with lung conditions sometimes struggle with their inhaler technique. Do you have any advice and are there any resources that you could signpost people to?
Well, I mean, first thing is I always remind my colleagues and all my patients that taking an inhaler is not like taking a pill. When you swallow your tablets or your capsules, you know they're going to the stomach and you can almost rely on them and on them doing what they're meant to be doing. It is so important that when you're taking an inhaler that you take it as well as you can, because if you don't, then the drugs don't get deep into the lungs where they do the most good, and they've got the chance then of being absorbed in different places. So if you're using the wrong inhaler technique, even just slightly wrong, then a lot of the drug gets wasted. It gets absorbed in the stomach, in the throat, in the mouth, and then that can cause side effects such as sore throat and thrush as well. So apart from making the drugs less effective, it also makes them potentially more toxic to people as well. So that's why it's so important to get the technique right. So my advice for everybody really is whenever you're given a new inhaler, make sure that your GP, your nurse or your pharmacist checks how you're taking it to make sure you're getting the best out of it and the drug can do its best for you and to keep you well. Also, pay a visit to our website. So Asthma UK, British Lung Foundation and lots of groups of experts in inhalers who are renowned worldwide came together to put together some videos so that every single inhaler can be taken the best way possible. But pay a trip to our website, have a look at those videos and make sure that you're doing it as well as you can. Now, there are two main types of inhalers. There's gas ones and there's dry powder inhalers, and there's very different techniques for both. For people, though, who are taking the gas inhalers, otherwise called a metered dose inhaler, we recommend that you should really be using a spacer with it every single time. And a spacer means that you can get your timing right, you can get more drug where it's needed, and reduce the chance of side effects as well. So if you haven't got one, ask your GP, your pharmacist, or your nurse if you can have one and be shown how to do it. And again, our videos show people how to use a spacer as well, so that can make a massive difference to people. And my final message is for people not to be complacent. Even if you were shown last year or 6 months ago, or you've used inhalers for years and years, pay a visit to the website, pay a visit to your pharmacist, or speak to your GP or nurse about them checking your technique. Because every little bit of that drug that can be got into your lungs can make a big difference to you. And every little bit that doesn't make it into your lungs is being wasted and can make you feel unwell or cause side effects. So do your best, don't be complacent, and keep checking your inhaler technique. And hopefully that can keep you well for longer.
Just to say that I'll be including a link in the description below to Asthma UK's inhaler videos page. So the next question, I think, is a new topic of conversation for us around long COVID. The long COVID's obviously been in the news quite a bit recently, and the British Lung Foundation has recently launched some videos to help people manage their breathlessness and to keep moving whilst they recover. Could you guide us through the differences between the symptoms of COVID and long COVID, please?
So I think the first thing, Joe, is I think putting the link on for those videos and the pages about breathlessness are really important. So anybody who's suffering with breathless or with long COVID or COVID symptoms can sort of pay a visit and make sure that they are safely and effectively recovering back towards normal. So yeah, really worth paying a visit to that site and seeing what's there. So people with COVID usually become ill within a few days of catching it. And the sort of symptoms that they commonly get is they might have a new continuous cough, they might have a high temperature, they might have changes in taste and smell. And there are some other symptoms which are now we're seeing that are more common, such as headache, lethargy, and things like that. So I think anything that's making people unwell with those symptoms, for most people, is mild and usually sort of goes away within the first couple of weeks. Some people might develop breathlessness after a few days. And I think if people start to get breathless, it's really important that they contact the NHS to make sure they get an assessment. Because sometimes COVID can be more serious, even if you've had your vaccinations. And it's really important to make sure that nothing is developing that needs extra treatment. So for people where the symptoms go on for longer than 2 weeks, which is really unusual, but it can happen. I think if it sort of goes on to as long as 4 weeks, then it's important to get in touch with the NHS again. There might be a side effect of the COVID that needs treating or assessing, and it's really important that your GP or whoever else in the NHS is able to assess you and make sure that you're getting all the treatments you need. The sort of symptoms people with long COVID get are slightly different from that with COVID. So people generally have breathlessness. It's usually tiredness and fatigue, severe tiredness and fatigue and lethargy. Joint aches are more common. Some people get chest tightness and chest pains. Although if you are getting this, I hope you will contact the NHS sooner to get that checked out. And when these symptoms are dragging on for 12 weeks, you need a more thorough assessment and help to actually get through the recovery period. So that the NHS clinics are a network that can help assess you, that can help get you on the right path to get you back to normal. Like I say, don't delay seeking help. So again, if you're feeling like you're getting breathlessness when you first have COVID, get in touch with the NHS. If your symptoms are going on for more than 4 weeks, make sure again you get assessed for any of the side effects of COVID that need checking out. And again, if it goes on for more than 12 weeks, make sure you get yourself referred to a long COVID clinic. But yeah, definitely pay a visit to our website, because the BLF and Asthma UK have been working together to put together some resources for people with long COVID to help support them and help get them back on the right track. And these videos are a brilliant step in that as well.
That's great. Thank you, Andy. As I say, I will make sure that all the links are in the description below for people so they can go and see those resources. So this is our final question for this episode. We've had more people than usual visiting our severe asthma web pages recently. So just wondering whether you could tell us what severe asthma is and how it's different to other types of asthma.
There's a few things to sort of pick apart in this. So for people who are diagnosed with asthma, for most cases, their symptoms can be quite easily controlled most of the time using quite low doses of medication. So basic inhalers at very low doses to try and keep in control and help to prevent them getting flare-ups as well. But sometimes people need their doses increasing if they're still getting symptoms, if they're needing their blue reliever inhaler 3 or more times per week, or if they're getting flare-ups of their asthma and they need higher doses of medication to help sort of dampen down the inflammation and help control those symptoms. When this does happen, some people do end up on higher doses of medication and still end up with symptoms or flare-ups. And at this stage, this is what we call difficult asthma. And difficult asthma needs checking out because sometimes it means that the diagnosis isn't right. So people don't have asthma, they've got something else going on with them. It could mean that they're not quite on the right medication for them. It could mean that they're not taking their medication regularly enough to make a difference or not taking it correctly enough. And that's where getting the right correct inhaler technique is really important. And sometimes there's things in the background like triggers or other conditions which make the asthma worse and harder to control. And these sort of checks can usually be done with an experienced GP or respiratory nurse in the GP surgery, or it might need referral onto a specialist. So where those things have been dealt with and people are still getting symptoms or a flare-up, then it's important they do get referred to a specialist at the hospital so they can be checked for what we call severe asthma. And severe asthma probably falls into 2 categories. There's people with asthma where it's so bad it just needs very high doses of medication. But there's also subgroups of asthma who've got a slightly different version of their asthma which needs specific treatment. In a severe asthma clinic, people will be checked to make sure the diagnosis is right, but also to see what sort of type of asthma people might have. And that's really important because that means that we can then make sure people are on the right treatment and any wrong treatments can then be stopped as well. But also that we can the clinics can do their best to make sure that whatever type of asthma that person has got, the asthma is not bothering their life too much. It's reducing the impact on them. And also, there are a lot more specialist treatments now available, what we call biologics and monoclonal antibodies, which are very good for very specific types of asthma. And there are some other treatments and therapies as well, which specialists got access to, which perhaps your GP won't. So I think the important thing is make sure that you aren't complacent about regularly getting asthma symptoms or flare-ups, and actually you should be working with your GP, your practice nurse or your pharmacist to try and make sure that you're on the right medication for you, that your symptoms are well controlled, you're not getting flare-ups, and if that isn't happening, then some of these other things are looked into or a referral to a specialist is done. So yes, severe asthma is really important. It's slightly different for people with normal asthma, but the impacts can be really, really devastating. And it's really important people get the right assessment and the opportunity to get the right treatments as well.
That's great. Thank you, Andy. That's really helpful. Once again, for everybody watching, I'll be including some useful links to the severe asthma pages on the Asthma UK website in the description below. And if you have found today's video helpful, please do add your comments below, give the video a like, or subscribe to the Asthma UK YouTube channel to be the first to hear about any upcoming videos from Dr. Andy. And also just to add, if you have found today's video helpful, please do consider making a small donation to help us continue our work for people with asthma and other lung conditions. Andy, once again, thank you so much for your time, and I look forward to catching up with you again next month.
Yeah, that'd be great, Joe. Looking forward to it. And I think one last thing is that for anybody who had any questions that have come up from today, don't forget our website. Have a look. There's loads of information on there. But we've also got our helpline, and our expert nurses can fill in any gaps or see how our general information applies to you.
That's great. Thank you, Andy. See you soon.
See you soon, mate. Bye-bye.
Thank you so much for watching today's Q&A with Dr. Andy, brought to you by Asthma UK and the British Lung Foundation. If you found what we've been discussing today useful, please do like the video, comment or subscribe to our channel today. As mentioned, you'll find lots of useful links below. And if you feel able to and you find our health advice useful, please do consider making a small donation today to help us continue defending the nation's lungs.